networking agencies to maximize experiences. I'm Jeanette, and along with my colleagues Gretchen, Mark, and Hamish, we are going to take you through a high-level overview of a implementation plan for a new program for the Department of Veterans Services. HIC has chosen this project because it best fulfills the overarching goals of modernizing the Medicaid system and also improving access to a target population, our veterans. We begin by kind of recapping the benefits and challenges of this new program. We will then go into the key pillars that ground our implementation strategies. And finally, we are going to deep dive into what that strategy is and talk a little bit about the implications for the future. Mark will now talk a bit and give you more context of the program itself.
So to let you know where we're coming from and like kind of our planning parameters, the opportunity here was that we had $100K to reward to the DVS to help enhance their ability to serve veterans and also relieve some of this burden of Medicaid and limited capacity by the DCH. The challenge was that the DVS is looking to expand their services. However, they are struggling with a lack of awareness and a little low enrollment rate. I believe 1 in 4 veterans were enrolled in VA benefits. Many of them claiming that the only reason they weren't enrolled was because they weren't aware of the opportunity. The target is veterans, and our implementation strategy is going to stretch over 90 days. Our overall primary measure of success will be the percentage increase of enrollment in eligible veterans for DVS benefits.
Okay, so our original plan, just to give you a quick overview, is called NAME. It stands for Networking Agencies to Maximize Experience. And you're probably wondering what is in a name. We have 3 thematic pillars. The first is going digital. So building into the already existing VA website an online application to complement the paper application they already have. We're also going to try to redirect traffic from Medicaid to the VA website through just a simple self-identification on the application to say yes or no, I'm a veteran. If they click yes, they can be redirected to explore that option. We are also developing strategic partnerships. We want to have a strategic partnership with media partners to get a PSA going so more veterans are aware that they do have this option. We do that through a partnership with a nonprofit agency who would give us a discounted rate so that way we can get a PSA out there. We're also going to have some shared distribution with Medicaid to take advantage of the print materials we already have and put those with the Medicaid material because they do have that interest in transitioning some of their clients onto the VA system. Finally, we want to expand human capital. We really want to take advantage of the employees on the ground who are working with these clients, either through the Medicaid office, or through community services. So we don't expect them to become experts, but we do want to have some seminars so that way they can feel comfortable with the eligibility requirements and the application process and better help their clients. So for the implementation strategy, we're kind of taking these 3 key themes and bringing it into those 90 days and looking at it more from a time perspective. Just to give an overview, we have developing, so establishing the necessary infrastructure, mobilizing, building a public presence, and then assessing, learning from the results to improve the system and go forward. Okay, so the first part we have is development. And this is really laying the groundwork and the foundation to really take off in the next steps. We want to establish a necessary infrastructure that lays the foundation for the project's success. This will be in about the first 30 days and will compose of a few key parts in all 3 of those thematic areas. So first, getting an initial website analysis going so we can kind of assess how we can best coordinate those 2 agencies and then get that application live. Additionally with that, we're going to have the connection of the media partner. We need to make that initial connection with the media partner so that way we can get the production of the PSA up and running. Also with that, we want to take all of the print material that we already have, coordinate with the DHA to make sure that we can get our print materials with theirs and kind of leverage that partnership to make sure that veterans who see the Medicaid information also see the VA information. And then finally, we need to finish a curriculum for these trainings and seminars, and then facilitate them so that way the people on the ground will know what's going on and can help their clients better. This would be somebody within the DVA, or Department of Veteran Services, who can develop all of that and then make those trainings happen. And then finally, we'll measure through how many of those action items we get completed, because this is really the key foundation to going forward. And we estimate about 40% of the funds will be used in this time.
The next key step of our implementation strategy is mobilization. We want to engage strategic partners in efforts to increase the public visibility and raise awareness. Our timeline for this is 30 to 90 days, and some of the key actions are to launch the website, roll out a media plan, distribute the targeted literature to veterans, and we're going to also monitor our performance with our partners. And we want to continue an open dialogue and really be critical of the feedback they give us to better improve our efforts. The measurements for this specific strategy is to track the traffic to the new VA benefits hub, and to also track the number of inquiries that DCH receives from veterans, and we allocated 50% of our funds to this distribution part of our strategy.
So to walk you through kind of like the consumer path of this, there's a bunch of different touch points in which veterans can seek insurance, specifically Medicaid or veteran benefits. And that's part of the problem. They're getting lost in their path to veteran benefits in the DVS itself. So all of our PSA announcements and media partners are agency partners, so this could be DCH, the local VA offices, or online devices. It's all going to funnel down to this portal we'll be creating. The portal will live within the DVS website itself. It's just going to picture like an added section where there is the online application. You can get a comparison of Medicaid versus veteran benefits, so they can understand better why they should be taking advantage of veteran benefits, and additional contact information if need be. And again, this is all meant to bring the focal point to that hub, and specifically the DVS, so that we can get the veterans themselves to the experts in veteran affairs, rather than inundating the DCH, who may not be as informed as the DVS counterpart, who could better serve the veterans.
Once we get that consumer pathway started and it's starting to flow, we need to assess. That's our third part, assessment of the current program that has been implemented. So the stakeholders in that would be the veterans themselves, the Department of Veteran Services, the Department of Community Health, and HIC. The timeline is the last 2 weeks of the 90 days focus on assessment. And the major part of the assessment is to create a feedback loop that allows for the continuation of restructuring or remodeling the program, dependent on the feedback, both quantitative and qualitative feedback provided by the information. Quantitative would include the data we receive, the data the department receives from the inquiries and the number of applicants. Also, that would include a discussion look at the enrollment data and the number of outlets used to redirect the veterans. Also, it looks at viewership and trafficking the users of the new portal. Qualitatively, it's important in the feedback loop to review the HIC strategic goals to make sure that they're able to continue to align with the major strategies of the HIC. Also, it's important to discuss the implementation challenges that the agencies are seeing. So in the feedback loop, there's an opportunity for the agencies to voice their concerns, voice what's working, and so they can kind of work out the kinks that way. Finally, it's important to provide continued support for the organization, which we, Deloitte, would be more than happy to see this through to the end. So with continued support, with the information we have, it's up to your disposal. Also, we believe that about 10% of the funding should be allocated to this assessment phase, and that is broken down into website, the assessment of the website. So how is it working? What's the traffic? How many people are filling out applications, as well as the partner satisfaction surveys. We want to talk about what's going well, what could be improved, and the data analysis of the website itself. And finally, a portion of that should be a flexible funding in case we find that other parts of funding are not sufficient for the full rollout of that plan.
So to walk you through our timeline in terms of the day 1 to day 90, we initially want to start off, we want to immediately develop and facilitate the seminars so our employees are educated. By the time that portal launches, whether you are in a VA office or in a DCH office, you can point the veterans, if they're coming in the right direction. We also want to make sure that we're establishing any partnerships with the agencies that we see relevant to help best serve the veterans, as well as media partners so that we can start working on that mass media approach and increase the overall awareness of the program. Around day 30, we'll want to launch that portal. We'll also want to make sure that we are beginning our distribution of literature that will be shared between Medicaid and DCH and DVS, so that if you are at a distribution point, maybe a local Medicaid office, you're not just presented with the one side of Medicaid, you can also pick up a pamphlet for veteran benefits if that applies to you. The next 30 to 60 days, you'll really want to optimize towards best performing practices and analyze the data that's coming in terms of traffic inquiries, any concerns. And by day 90, you'll really want to take a real deep dive to assess the information you've gotten so that you can develop your next step in optimizations in a sustainable strategy.
Looking further into the future, looking long term, there's two parts of looking forward. First is short term, then long term. Short term, we want to purposefully engage with periodic check-ins, either through facilitation by the HIC or through interdepartmental, interagency communication. Also, there's an importance to revising the implementation strategy, work out the kinks using the feedback loop. Data mapping is important to the website usage for the applications and how many people are using the website, how many people are applying. Also, review of the budgetary landscape. It's important to acknowledge that there are budgetary constraints throughout the system, throughout the year, and it's important to know how much money can be allocated as time goes on. We understand that's a concern. Long-term, the utilization of the Paris system we find to be an important long-term goal. Long-term, because they're still going after the media and the creation of the website. It will be difficult to get some people who are still on Medicaid off Medicaid and onto the VA system. So we're looking to stop the bleeding with our original plan and then work on kind of figuring out who's in the system still and who may be having Medicaid that can shift over to the VA system. Also, the evaluation of, it's important for us to evaluate the overall impact on the percentage of veterans using the VA system over the Medicaid system.
Are there any questions?
I have a question. And as usual, probably multiple. So if you roll back to the first phase of your implementation plan, so in that first phase, you're doing a lot. You're going to, I'm focused just on the first bullet, which is portal development. Presumably, you're going to have to define the requirements for that portal, correct? You're going to have to design the portal. You're going to have to develop the portal. You're going to have to release the portal and market it before development. That's one of the bullets in the first phase. My question to Deloitte is, knowing that you have to do all those activities, are you willing to sign up today that you can do that in 30 days?
Because the portal will be built onto the existing DVS website, a lot of the infrastructure is already there. We're not going to create a new website or a complete new web design. The framework is there, so it's going to be more about taking the necessary content that will essentially the missing information for veterans, putting it as an extra section in the website, and launching it within day 30. The marketing plan is more to help raise awareness once that's launched, but until that exists, we can't really advertise that because there would be nowhere for people to go for information.
So you're convinced you can design, do all the integration, And probably we, as a state, I believe, would want to get some veterans benefits for what they're looking for in the portal in 30 days.
It's
Okay.
based on the assumption that the framework of the actual portal is already there with the DBS site that exists.
Okay, and in order to do that, are there going to be interim milestones, or you indicated the measurement is just that we're complete when we're complete, the way I read that, right? The measurement says action items complete, so this is we're complete when we're complete. Are there any interim milestones?
The interim milestones would probably be a little bit more broken down to the subcategories of each. So we're developing seminars, but there's going to be a little bit more intricacies to that. Due to the time constraints, we want
To define the interim milestones.
Yeah.
Okay, good, thanks.
I did have a question. You talked about your long-term strategy about getting people completely on Medicaid. I'm wondering, why are you spending the $100,000 and everything to try and catch people who haven't even gotten on Medicaid yet? Why did you decide to focus on people who potentially are applying to Medicaid rather than trying to get folks that are currently on Medicaid that would be eligible for it?
We saw this somewhat, it's a two-part system, so we need to, a lot of veterans just aren't aware of the system that they could potentially have benefits on. They don't know the DVS system, they don't know the VA system, they don't even know the benefits. So it's important to get the media campaign out there so they're able to be aware of the system. Now, when you reapply for Medicaid, it's important, there'll be that additional expectation where they can apply and say, okay, I'm a veteran now. There's that new addendum, there's a new bit where they can say, I'm a veteran now, or I've always been a veteran. I was never asked this question before. And then that's going to take you either from working at the physical office site, where the person who has been trained through our seminars can be cognizant and aware of what to say so they can be directed towards the DVS, or on the website to be transferred to our portal to do so.
You're expecting to catch current Medicaid enrollees when they're up for renewal then?
Yeah.
Is that correct?
As well as also when in those community organizations, if a veteran comes in and self-identifies as a veteran, that's why we're training people, so they can catch that and say, you might have this other option, it's there to consider. And then they can better show them that.
And may I add on a bit to that too? In the first year, the federal government is taking on 100% of the cost of Medicaid and 100% of the cost of veteran, because it's moving towards 90-10 as time goes on. So the federal government on Medicaid is already spending 100% moving forward. So we have at least a year to get up and moving more and more consistently when they reapply. There's a bit of a time where the cost savings kick in at greater amounts as years go on, so there's more of an incentive to kind of get that going.
I think we're at time.